Antimicrobial resistance, AMR, a term that is increasingly making headlines across the globe, but particularly in India, where it's being called a growing crisis in healthcare. It's a silent battle that's becoming louder with every passing year, and sometimes it comes to a point when doctors find themselves helpless. We spoke to Dr. Devi Prasad Shetty, a cardiac surgeon who is also the chairman and founder of Narayana Health, on the issue of AMR.
In the first 10 years of my life as a heart surgeon, who was involved with large number of heart surgeries, initially in Calcutta and then in Bangalore. When a patient after the heart surgery became unstable, sepsis was never a diagnosis. I used to stop antibiotics just after 24 hours or 48 hours of antibiotic after the surgery. Today, when a patient becomes unstable after the heart operation, the first diagnosis is sepsis. First you rule out sepsis, then you look at the myocardial function and all the other reasons. This is very, very scary.
Sepsis is a life-threatening medical emergency that occurs when the body responds improperly to an infection or injury. Sepsis may progress to septic shock. This is a dramatic drop in blood pressure that can damage the lungs, kidneys, liver, and other organs. After surgery, it is no longer a secondary concern. It becomes the primary focus. Doctors suggest that nearly 45% of sepsis cases in ICUs are caused by drug-resistant bacteria, particularly multi-drug-resistant bacteria.
As doctors, we can do amazing things. But today, when our patients get infected with resistant bugs, we are totally helpless. Hours and hours of hard work of recreating the heart or the aorta or any of the vital organ of the adult or the children just gets washed away with this antibiotic resistance bacteria.
This is not only in the case of heart surgery. Recent data paints a grim picture for India. The country consumes the highest amount of antibiotics in the world, fueling a crisis that goes beyond the hospital walls. One of the biggest contributors to antimicrobial resistance comes from the food we eat. Despite the growing concerns, the use of antibiotics in livestock feed remains largely unregulated. As a result, the antibiotics we rely on for human medicine are slowly losing their effectiveness.
One of the suggestions we had many years ago to the government is restricting the use of antibiotics in veterinary practice, especially antibiotic in feed for the animals. In 2006, European Union banned the use of antibiotic in livestock feed. They banned it completely. Even in US, that is restricted significantly. But till now, we haven't been able to reduce or even try to stop the use of antibiotic in the livestock. In the process, all the meat we eat is saturated with antibiotics, and in the process, most of the antibiotics are becoming useless.
While industries are working to develop new antibiotics, there is no guarantee that a breakthrough will come soon. In fact, some experts suggest it could take 5 to 10 years before we see effective treatments for resistant infections.
I know industries are working hard to develop antibiotic for drug-resistant bacteria, but I don't think anything will be available during the next 5 to 10 year horizon. So, at least we have one option of controlling the usage of antibiotic in treating patients and in utilization of antibiotic in livestock. If we can start working in this direction, we have some hope. Otherwise, more and more of the existing antibiotic will also become resistant. Then, performing any surgery, even minor procedure, will be a great challenge. We may go back to the pre-penicillin era where most patients died not because of the surgery, they died because of the infection.